So, of course, South Africa is in its fourth wave, and this, of course, as we head into the festive season. There are real concerns about the rapid increase in infections that we've seen even this week. But the Health Department is reassuring South Africans that vaccines do offer protection against the highly transmissible Omicron variant. Government urging those who are yet to be vaccinated to get their jabs to protect themselves. Our reporter Heidi Giokos has been following the story, joining us now. Hello, Heidi. So there was that briefing this morning. The fact that Omicron is spreading so quickly and is able to break through people's immune systems, that's a real concern. Talk to us about the trend around transmissibility that we're seeing.
Yes, indeed, Sally. So we do know that if you do get Omicron, you could infect up to 2 to 3 people. The Department of Health making it very clear that this is worse than what we saw with Delta in terms of how fast this variant is moving and how quickly one can get infected with the Omicron variant. We also do understand that Gauteng province is, of course, the epicenter, with the majority of cases being in the Gauteng province. But the Department of Health has also picked up that, for example, KwaZulu-Natal is seeing a surge in cases, as well as the Western Cape. And the health minister saying that possibly in the next week or two, you will see most provinces seeing a surge in cases. Of course, Gauteng has always been seen as the epicenter, as there's so much movement that goes on here. We saw it with the third wave as well, where the majority of the COVID infections were in this province. We're seeing it again with the fourth wave. And the health minister saying that KwaZulu-Natal and Gauteng seeing over 100% increase in cases. Gauteng alone saw an increase of over 400% in COVID infections. So it just tells you how quickly this variant is actually moving. The positive in all of this, Sally, and we must always try and find the positive, is that it's a lot milder this time around, especially in the vaccinated. And this is why the Department of Health is saying that as much as we use other measures such as social distancing, mask wearing, sanitizing, not gathering in crowded spaces, vaccination seems to be a very powerful tool, because if you are vaccinated, the chances of you falling very ill are highly unlikely, because the vaccination provides some kind of protection. But let's listen to the Department of Health on this matter.
What is known currently in terms of transmissibility, well, it's not yet fully very clear, but it seems likely that it is more transmissible, just looking at the way in which it has spread over a very quick period, with a very steep graph of the spread of the infections over the last 15 to 20 days. As if you compare that to how the previous variants, such as the one which we just which it is just replacing now, the Delta variant. So we can see a significant difference in the graph of how Delta spread and how Omicron is spreading. Omicron very quickly has displaced Delta, is quickly, quite seriously displacing the Delta variant. In Gauteng, almost displaced it. The number of people testing positive has risen in Gauteng, and this variant, the Omicron, has also spread by now to all the provinces.
And Heidi, what do we know about children and Omicron? Because there was such concern about hospitalizations a few weeks ago.
It seems as though there's been some kind of shift, Sally. I wouldn't necessarily call it a shift, but it seems as though the people who are being hospitalized, yes, of course, it is still those under the age of 19, and you are seeing younger children also being hospitalized. The Department of Health saying this has a lot to do with the exposure and being susceptible to the variant, because they're mostly unvaccinated. But the NICD also highlighting the fact that those between the ages of 20 to 39 years old and the 40 plus are being hospitalized, and it's among the unvaccinated. So to put it into context, 70% of those that are hospitalized currently, most likely with the Omicron variant, are unvaccinated. And the Department of Health saying that this is why it's imperative for people to consider getting vaccinated because of the kind of protection it offers. What's also important is the fact that if you are hospitalized with COVID-19, it seems as though your stay is a lot less. It's shorter than what they saw during the second and the third wave. Also, there isn't much of a need for oxygen and ventilators, which is what we saw with the Delta variant, where there was such a need and demand for oxygen. This is not really the case with Omicron, especially in the vaccinated. So if you hospitalized and you've been vaccinated, your stay is very short and it's very mild infection. And even the unvaccinated, yes, you might be hospitalized, but they've seen nothing alarming. However, just yesterday we saw over 400 people being hospitalized in a 24-hour cycle. So the Department of Health saying nothing to be too alarmed about, but they are monitoring the situation very closely. And also, it's still very early days, so we do know that they're still trying to gather data and information, but there seems to be some glimmer of hope with how it's not too serious as yet, especially on the hospitalization side. Let's listen to the Department of Health on that again.
The issue of infection of children, let me just touch on that. During the 3-week period from 14 November to 4 December, there has been an increase in admission of children under 5 years. This has been observed in the Tshwane Metro hospitals, where the early resurgence has occurred. Children 18 years and younger comprised 21% of admissions during the early period. However, this pattern has changed over the subsequent time from the early days, and the proportion of admissions in children less than 5 years in total admissions has decreased to 14%. It was 21, then 14% in week 46, and currently it's even lower at 8%. So this seemed to have been the phenomenon early, but it has now changed to more adults getting infected.
Talk to us as well about the booster shots, Heidi. They are now available also for those 12 to 17 years old, and of course the older age group. Starting perhaps with the confusion, you and I were chatting about this on the program yesterday. SAHPRA the day before had issued another dose for 12 to 17-year-olds who were immunocompromised, but didn't say anything about the general group. That issue was cleared up, though.
Yes, it was cleared up, Sally. We do know that booster shots, well, it's not necessarily called a booster shot. I think we need to just be clear on that, especially for the age group 12 to 17-year-olds. It's still called what they call a primary vaccination, because previously those between the ages of 12 to 17 years old were not getting a second Pfizer shot. They were only getting one Pfizer shot because they were worried about complications around heart inflammation. But of course, the medicine regulator going through that data and finding that indeed it is safe to get a second Pfizer shot if you are between the ages of 12 to 17 years old. And this is already starting to roll out. We know that as of yesterday already, those between the ages of 12 to 17 were eligible to get a second Pfizer shot. So it will be 42 days after you received your first Pfizer jab that you will be eligible for another shot. So sorry, these insects. Sorry. So that is important to highlight. And then those those over the age of 60 will be able to get a booster shot. Now that is called a booster shot because one must remember that if you were over the age of 60 and those, of course, over the age of 18 they got a second Pfizer shot, so they will be eligible for a booster shot, which is a third shot as well. These insects, I don't know, I must be very sweet to you. But let me just focus on it.
It's absolutely fine, Heidi.
As of the 28th of December, Sally, those who got their second Pfizer shots, and it's 6 months past when they got their second Pfizer shots, as of the 28th of December, they would have already been eligible to get their booster booster shots. So that is going to be important. The Department of Health emphasizing the importance of getting booster shots because it provides more protection. And because we don't really know what these vaccines do when it comes to Omicron, there is some evidence to suggest that there is some kind of protection, especially against severe infection. They are advising that you get your booster shots.
Absolutely. Heidi Giokos, I think you've got zooming insects while we're on Zoom to you. I'll leave you to deal with those. But thank you very much for that update. And of course, those of you who were expecting to perhaps hear from the President on possible restrictions this weekend, we now know that the Health Minister saying that the National Coronavirus Command Council is only going to be meeting on Tuesday or Wednesday next week. So any possible tightening of restrictions is only going to happen around midweek. So you've got a few days grace still.